Hi, welcome to Pain Insights. I'm Jason, your Insight PT and coach. So today's topic has to do with how pain works. When I'm working with folks who experience persistent or chronic pain, it's very often the case that over time they've met lots of healthcare providers and they've come to find out more about their body than they truly ever wanted to know. And along the way, they'll be told a lot of things about why it is presumed that they're hurting that can be confusing or maybe even conflicting in terms of one explanation might conflict with another explanation. But one way or the other, when a person hurts all the time and it's not very predictable as to how much they're going to hurt the next day or how their body's going to respond to one activity or another, and on top of that, maybe they've noticed that their pain at times can change in its quality and location, or weird things like changes in the weather can make them hurt more. One way or another, when there's all that uncertainty, unpredictability, and confusion about a person's pain, it can leave them feeling frustrated, disappointed, worried, angry, sometimes even downright scared. But understanding truly how pain works really matters. It matters for all sorts of reasons. It's important to understand how pain works, what happens in your body when it becomes chronic or persistent, how that applies to each person individually, and what they can do about it. And when they learn more about pain, it's very common that the things that they once believed or came to understand about their pain were either what was incomplete information given to them, or inaccurate altogether. So the way that I've been taught to explain how pain works to patients has to do with a metaphor that we call the alarm. And the idea is when you have an injury, typically you'd expect the alarm to go off. So let's say pain works like an alarm, and your alarm would be like a house alarm or a car alarm or a smoke alarm. When that alarm goes off, that means you're hurting. So if pain is an alarm, then your alarm system would have to be your nervous system. And if you were to say step on a nail, I hope that your foot would hurt. The next question would be, well, how does that work? Why would you have foot pain? Or how would you know that there's a nail in your foot, in other words? And the answer would be that you have nerves in your foot that would send messages up to your spinal cord, pass it up to your brain, and then that's how you would then experience the pain. So when that happens, you take the nail out of your foot, you go get help, get it treated. Over time, it'll heal. Temporarily, that alarm will be a little more sensitive. It's going to go off more easily if you put too much weight on it, or if you put too much pressure on the area for some reason, or if it starts to get infected, it won't heal, so it'll stay inflamed and more sensitive as a result. But generally speaking, all injuries do heal, and as that happens, it's more often than not the case that the alarm will calm down along the way. But when pain becomes chronic, there are different things that happen in the alarm system or the nervous system, and the pain will become persistent or chronic as a result. And what that means, metaphorically speaking, is that the alarm will stay sensitive and go off more easily than it would if the pain had followed the same course of the injury healing. So it might be 5 years after initial injury, and the body part that hurt to begin with still hurts to this day, and it hurts if the weather changes, or if you stand in place for too long, or if you sit for too long, or if you bend over too many times. And what that means is their alarm system has become extra sensitive or sensitized. And that's not a personal judgment or a statement about that person's character or pain tolerance. It just means that physiologically that their nervous system has become more sensitive, and that area has become more sensitized. So this really matters when you're looking at pain when it becomes persistent, because there are a lot of things that contribute to this alarm, some of which people might be familiar with or heard about, like things like tension, or if you push into pain and try to push through it repeatedly over time, it'll, as I like to say, wake the bear. And that'll keep your alarm more sensitive. And then there are other things too that keep your alarm more sensitive that might surprise people, like not sleeping well at night or carrying a lot of stress. So these are some of the things that go into why a person's alarm system will remain sensitive, or it might fluctuate over time, but overall it'll stay more sensitive in certain areas than other areas because of these factors that I'm describing. It's more often the case that folks are led to believe that the reason why they hurt has more to do with damage or degeneration that has occurred in their body over time. And the evidence for that is weak, to say the least. I can go into a great deal of detail about this, but things like degenerative changes in our joints, like degenerative disc disease, for example, is as common as wrinkles on our skin. We all get wrinkles on our skin. Why wouldn't we get wrinkles on our spine too? It does not mean that these sort of structural abnormalities and degenerative changes are completely irrelevant when a person's experiencing pain. It depends on the finding, and it depends on the person's circumstances. But more often than not, this is just one small part of the picture when you're looking at all the different contributing factors to one's sensitive alarm system. So I hope you found this at least interesting and maybe sparked an interest in learning more about this topic, because the bottom line to this is when we understand better how pain works, it can go a long way to reduce the fear and frustration that we might have about our circumstances as we understand the true nature of the pain better. But it also will allow us to see with more clarity what sorts of things that contribute to the pain that we have say-so or agency over. And that then puts power back in our hands. So if you find this interesting, I hope that you'll check out some of the other videos, or maybe check out some of the classes that I offer, or inquire about working together in some form or fashion, whether that be through coaching or physical therapy. And you can reach out to me through my email address, which is jason@insightandpowers.com. But until we see each other again, I hope that you take ridiculously good care of yourself. May you be well. If you like this video, please hit like and subscribe. If you'd like to find out more information about how to work with me, check out our website at insightandpowers.com. There you'll find information about the classes that are offered, as well as PT and coaching services, should you be interested. Until then, take care and may you be well.